Hi folks, a little bit more serious today because we just had another infant die of the flu in this area. It's like the second in this region this year, which is somewhat concerning considering we're only in January and the flu season is rampant. So the question is related to that general topic, so that's why I thought I should address it. As a pediatrician, it's concerning that a child will die from the flu, but as a father, I'm worried as well because these couple of deaths are previously healthy kids, and even adults are dying from the flu who are previously healthy, so it kind of hits home with me. Anyway, the question is, I don't know if this is an easy or difficult issue to address on your Facebook series about sepsis, but how does flu or strep develop into sepsis? What should we look for? And I assume that the question is based on the fact that these deaths that have occurred are considered or called sepsis deaths. So I think first we need to just address what sepsis is. And sepsis can be caused by a number of organisms. It's not just the flu. It can be viruses, it can be bacteria and funguses and parasites. So they get into the body and they cause an infection. Then this infection becomes very fulminant or overwhelming, and it affects the whole body, and it can include a fever, but it also includes a racing heartbeat and rapid breathing, and you can have cool extremities and color changes. You become pale. That's kind of the general description of a sepsis. But when you have sepsis, you're sick. You look sick. You don't walk into work with sepsis generally. You're generally lying around and you look bad. So that's what sepsis is. And you can get sepsis from any infection, like I said. So you can have a strep throat that can present to sepsis, which means it starts to overwhelm the whole body. When it overwhelms the whole body, it affects the lungs, it affects the kidneys, it can affect your GI tract, and it can actually affect your heart as well and start to shut things down. And when the sepsis overwhelms your body, then your body shuts down and you die from it. There's now the flu presentation can be sometimes confused with sepsis. So, the assumption when someone comes in the office and they have a fever and they look sick, you just assume that it's going to be the flu. Recently, there were some cases, including adults, that they presented and they were diagnosed as a virus or a flu, but they in fact had sepsis from a bacteria. And as you already know, bacteria can be treated with an antibiotic and hopefully cured, while the flu, on the other hand, cannot be cured with a drug. There's a drug that's out there that can make the flu symptoms less severe, but it doesn't cure the flu. You can have a flu, this is getting confusing, that actually can progress to sepsis, where it overwhelms the whole body and makes your organ system shut down. So let me just summarize this, because I know it's a lot of stuff, but sepsis is when you get an infection from something and it progresses and overwhelms your body. You're generally very sick, very sick, like you look terrible and your fever's up and your heart's racing. And like I said, you can get that from a flu or bacteria, from a virus. If it's a bacteria and it's addressed, you can be treated with an antibiotic. You can also have the flu, which is totally separate, and that flu can present with a fever and high heart rate, not necessarily labored breathing, but just feeling bad and looking bad. That can't really be treated with medicine to cure it. It can be treated with a medicine to kind of tone it down, but not cure it. Any infection can progress to sepsis, including the flu, including the virus, including the parasite. So the important thing is to address it, to determine why you look that sick or why your child looks that sick. In the office, you just do a flu test, which is a rapid test and that can give you the answer. Is it flu? Is it not flu? If you look that sick and you don't have the flu, that may mean that you have something more serious, like an infection that's progressing to a sepsis. That's unusual, but it's a way of diagnosing it. Like I said too, it doesn't mean just because you have the flu, you can't get sicker and sicker as a result of sepsis from the flu. One way or the other, you still need aggressive treatment to address any issues that you'll get with the organ shutdown. Anyway, that's in a nutshell. It's rare, but it's possible to die from the flu. It's not very common to get a sepsis as a child, maybe more as an infant when you're more immunocompromised than when you're an older adult. It's rare to die from flu that progresses to sepsis, but it's happened and it's happening now, and that's why it's scary. So any question, I wouldn't sit around and wait and treat with Tylenol or Motrin. I would just go. Just go to the pediatric office or your family office or ER and just get addressed so you can get a diagnosis. And once you get a diagnosis, you can get treatment. Anyway, that's it. Thanks very much for the question. Bye-bye.